Hello, my name is Casey Lee Bedford, and I'll be presenting negative pressure wound therapy as my clinical resource. I chose this as this topic will be useful for new grad nurses as it's a complex dressing within their scope of practice and is commonly used in present day due to its clinical benefits. This procedure is also significant to be educated to new grad nurses as it is regularly seen and used on inpatients and outpatients. A VAC dressing is known as negative pressure wound therapy. The use of this was developed in the early 1990s. These methods consist of the application of negative pressure to a foam or gauze placed inside a wound. The wound is sealed with an airtight adhesive film that prevents the entry of air from the external environment. Negative pressure wound therapy has been reported for its clinical use in a diverse range of wounds used to decrease air pressure around the wound to enhance healing. Here is a diagram of how a VAC dressing works. Negative pressure wound therapy is used with chronic persistent wounds, acute complicated wounds, traumatic wounds, partial thickness burns, ulcers including diabetic, venous and arterial ulcers, pressure injuries, skin flaps, grafts, and sometimes fistulas. Here are just some photos that are some examples of what wounds can be used with negative pressure wound therapy. The therapeutic goals of negative pressure wound therapy are to promote granulation tissue, prepare a wound for closure, control edema, manage exudate, achieve wound stabilization, and assist in stabilization if patients with complex and traumatic wounds. Here is an example of how wound healing is shown through a diagram. There are advantages of negative pressure wound therapy. Some of these benefits include improvement of wound homeostasis, wound bed appearance, granulation tissue formation, and tissue perfusion. Other benefits and advantages include wound retraction by the negative pressure pulling on the wound margins, wound cleansing through a removal of small tissue debris by suction, removal of wound exudate through a closed system, pressure-related reduction of interstitial edema with consequent improvement of local microcirculation, promote a moist wound healing environment using continuous or intermittent negative pressure, prevention of wound breakdown in a surgical incision by splinting the wound and closing the dead space within the wound, can simplify wound management and progress wound healing to a point where it is suitable for things such as skin grafts, flaps, also that the patient can be discharged into the community using traditional dressings. VAC dressings will be completed by nurses that are specifically trained in this dressing. And you should always consider as a nurse when they should be changed, which is every 2 to 3 days, or maybe more regularly if it's infected. Certain tasks that you should always be performing are things such as working within your scope of practice. If you have never done a dressing like this before, get your educator or a senior RN to help assist you with this dressing. Other tasks you should complete before doing the dressing is complete patient education on the dressing. You can always give them the patient education booklet. It's really vital that the patient understands why negative pressure wound therapy is necessary and how it works. You should also complete patient-informed consent. This is a legal requirement you should do with all procedures. Read the facility's updated policy. This is therefore practicing evidence-based practice. A lot of policies are very similar, but it depends on the certain facility you're working at. Gather all equipment that is needed by the bedside before starting the VAC dressing. Always consider pain relief before starting the VAC dressing, as some VAC dressings can be painful to some patients. And of course, always abide by the standard infection control practices such as hand hygiene, antiseptic non-touch technique, and appropriate PPE. Next are the different types of VAC dressings that you'll need to know about before changing VAC dressings. So there are different types. which are listed here, which you can have a bit of a read about. Some are portable, some are not. Some are suitable for inpatient setting only, some are suitable for outpatient community setting and inpatient setting. Some run continuously or some run intermittently. It just depends on the device and the surgeon or the team's preferences on which device they want to use and what's the best one for the wound in order to heal. Before changing the negative pressure wound therapy dressing, it's very important to make sure the order is correct and valid. So these things include the wound dressing material, foam or gauze, which is to be used, and wound adjunct, protective non-adherent petroleum or silver dressing. It depends on the surgeon or the team's preferences, really. It should also include the negative pressure setting, the therapy setting, whether it's continuous or intermittent, and the frequency of dressing changes, usually every 3 to 7 days. So to actually perform the changing of back dressing, it is vital to follow your specific facility's policy on negative pressure wound therapy. Most policies are very similar, but it is essential to follow your facility's updated policy protocol to practice evidence-based practice. Here is an example of the Illawarra and Shoalhaven Local Health District policy. Here is a step-by-step guide that could help you with the removal and change of a back dressing if you didn't have any help. This is only a general guide, so please make sure you're following your policy, your facility's policy, as this is only a guide and it may differ depending on the facility you're at. After the removal and change of the negative pressure wound therapy dressing, it is vital to document specific things. Whilst changing the dressing, you should perform a wound assessment and management plan. This can include measurements of the wound and a description of the wound. Is there exudate? Is there blood? Is it hot? Is it red? Is it swollen? In your documentation, you should also include the rate of the negative pressure wound therapy machine is set at, the type of therapy being used, whether it's continuous or intermittent, when the dressing should next be changed. If an incident were made during the procedure, make sure you complete an IMS, but also put in your progress note, if it was a breach in like PPE or something or infection control. Make sure you document that in your progress notes and an IMS and an incident report. If the wound is not improving, put a referral in for a wound CNC. Also notify the team to review the wound. All of this can be documented in nursing progress notes, but also the negative pressure wound diaries or charts and other additional documentation that will be provided for you anyways in the patient's folder. Lastly, things you should consider when caring for a patient with a back dressing on and operating is things like preparing to perform the negative pressure wound therapy is you should know the type of device, which type you're going to use. With showers, things like that, patients can shower with back dressings on, but they need to be connected and they can only be disconnected for no more than 2 hours each day. Patients cannot take a bath due to increased risk of infection. Sitting in bath water can also make the dressing loose. Lastly, performing back dressings are very time consuming, so leave an appropriate amount of time to complete the tasks and prioritize other tasks first if required. Thank you for watching my presentation. I hope you enjoyed. Here is my reference list.